Top 25 Health Informatics Manager Interview Questions and Answers. Welcome to Interview Q&A. In today's video, we'll explore the top 25 Health Informatics Manager interview questions and answers. Perfect for anyone preparing for roles in healthcare data management, digital transformation, or EHR system leadership. Whether you're stepping into your first informatics role or advancing into management, these answers will help you sound confident, competent, and job ready. So grab a notebook, stay tuned till the end, and let's make sure you ace that interview and land your dream job. 1. Can you explain what health informatics is and why it's important? Health informatics combines healthcare, information technology, and data analytics to improve patient outcomes, operational efficiency, and evidence-based decision-making. It focuses on collecting, storing, and interpreting medical data using electronic health records, EHRs, clinical systems, and data tools. The importance lies in its ability to connect data across systems, streamline communication among healthcare providers, reduce errors, and enhance patient safety. By transforming raw data into actionable insights, informatics empowers hospitals and clinics to make smarter decisions, manage costs effectively, and deliver personalized care. A good health informatics manager ensures technology aligns with healthcare goals, compliance, and patient privacy regulations. 2. What are the main responsibilities of a health informatics manager? A health informatics manager oversees the design, implementation, and optimization of information systems in healthcare settings. Their responsibilities include managing EHR integration, coordinating between IT staff and clinical teams, ensuring data accuracy, and maintaining HIPAA compliance. They analyze workflows, identify gaps, and develop data-driven strategies to enhance clinical efficiency. Additionally, they lead training programs for staff, handle vendor relations, and monitor key metrics like patient safety, billing accuracy, and turnaround time. In essence, they bridge the gap between healthcare delivery and technology innovation, ensuring systems support clinical excellence and operational goals simultaneously. 3. How do you ensure data privacy and security in healthcare systems? Data security in healthcare requires a multi-layered approach. I ensure compliance with HIPAA, GDPR, and local data protection laws by implementing encryption, secure access controls, and regular audits. Role-based permissions restrict data access to authorized users only. I also emphasize cybersecurity awareness by conducting training programs for all staff. Regular vulnerability assessments, firewalls, and intrusion detection systems further safeguard sensitive data. Additionally, I ensure that all third-party vendors adhere to strict security protocols and that backup systems are regularly tested. The goal is to create a culture of continuous vigilance and privacy protection. 4. What challenges do you often face when implementing a new EHR system? EHR implementation challenges typically include user resistance, workflow disruption, data migration issues, and interoperability problems between legacy systems. Clinicians may initially resist change due to the learning curve. To address this, I conduct early stakeholder engagement, clear communication, and hands-on training. Another challenge is data integrity during migration, so I ensure thorough validation and testing. Downtime planning and post-go-live support are crucial. The ultimate key is change management, aligning technology with real-world workflows and ensuring the system enhances rather than hinders daily clinical operations. 5. How do you measure the success of a health informatics project? Success is measured through both quantitative and qualitative metrics. Key performance indicators, KPIs, include system uptime, user adoption rates, data accuracy, and efficiency improvements in clinical workflows. Cost savings, reduced duplication, and better patient outcomes are also indicators. Post-implementation surveys and feedback from clinical users help evaluate satisfaction and usability. For example, if EHR documentation time drops by 25% or medication error rates decline, those are measurable wins. Ultimately, success means the technology aligns with organizational goals, improving care quality, compliance, and productivity across departments. 6. What is interoperability, and why is it vital in healthcare informatics? Interoperability refers to the ability of different healthcare systems and applications to exchange, interpret, and use data seamlessly. It's vital because healthcare involves multiple stakeholders, hospitals, labs, pharmacies, and insurers, all using different platforms. Without interoperability, data silos form, leading to inefficiencies and medical errors. As a health informatics manager, I promote HL7 and FHIR standards to enable data exchange. Interoperability ensures that patient information follows them across care settings, enabling faster decisions, coordinated treatment, and improved outcomes while reducing duplication and administrative burden. 7. How do you handle resistance from clinical staff during system changes? Resistance is natural when workflows are disrupted. I start by communicating early, explaining the why behind the change and showing how it benefits both staff and patients. Involving clinicians in the design phase helps them feel ownership. I also provide continuous, hands-on training and create super users who assist peers. During rollout, I keep feedback channels open and address concerns promptly. Recognizing and rewarding adaptability also boosts morale. Change management isn't just about technology, it's about trust, communication, and empathy throughout the process. 8. Describe your experience with electronic health record (EHR) systems. I have extensive experience working with EHR systems such as Epic, Cerner, and Meditech. My role involved system optimization, user training, and ensuring compliance with clinical documentation standards. I've managed system upgrades, built customized workflows, and led projects integrating EHRs with lab and billing systems. My focus has always been on improving usability and minimizing clinician burnout through intuitive designs. For example, implementing customized templates reduced charting time by 30%. A strong grasp of both clinical workflows and IT architecture has helped me bridge communication between users and developers effectively. 9. What steps do you take to maintain data quality and accuracy? Data quality starts with clear standards and consistent monitoring. I implement validation rules, mandatory fields, and regular audits to catch inconsistencies early. Data governance committees help set quality benchmarks across departments. I also conduct training sessions to ensure accurate data entry by clinical staff. Automated alerts flag missing or incorrect entries. In analytics, I apply data cleansing and normalization processes before reporting. High-quality data is critical for patient safety, billing accuracy, and research integrity, and maintaining it requires a combination of human diligence and automated checks. 10. How do you stay current with trends in health informatics? I stay updated by following reputable organizations such as HIMSS, AMIA, and the Office of the National Coordinator for Health IT. I regularly attend webinars, conferences, and certification programs like CHIM or CPHIMS. Reading journals like Journal of Biomedical Informatics and participating in LinkedIn professional groups helps me stay aware of new technologies and regulations. I also network with peers to exchange real-world experiences. Staying current ensures I can anticipate upcoming changes, like AI in clinical decision support or new data privacy standards, and prepare my team accordingly. 11. How do you handle system downtime or data loss? Preparation is key. I ensure disaster recovery plans are in place, including regular backups, redundant servers, and secure off-site storage. During downtime, communication protocols ensure staff know how to continue critical operations using manual processes. Incident response teams handle containment and restoration steps. Post-incident, I conduct root cause analysis and strengthen weak points to prevent recurrence. Transparency with leadership and staff is crucial during such events. The goal is to minimize disruption, protect data integrity, and restore systems swiftly while maintaining patient safety. 12. Can you describe your leadership style? My leadership style is collaborative and adaptive. I believe in empowering team members by aligning their strengths with project goals. I maintain open communication, encourage innovation, and provide constructive feedback. In fast-paced informatics environments, I balance structure with flexibility, giving clear direction while trusting experts to execute their roles. I also emphasize mentorship, helping staff grow technically and professionally. By fostering a positive, transparent culture, I ensure projects run efficiently and teams remain motivated even during complex transitions or system rollouts. 13. What's your approach to managing multidisciplinary teams? Health informatics projects often involve clinicians, IT professionals, analysts, and administrators, all with different perspectives. I focus on creating shared goals and clear communication channels. Regular team meetings, project management tools, and collaborative documentation keep everyone aligned. I translate technical jargon into clinical language and vice versa to ensure mutual understanding. Recognizing each member's expertise fosters respect and cooperation. When conflicts arise, I address them promptly through dialogue and data-based decision-making. Effective multidisciplinary collaboration is the key to any successful healthcare technology initiative. 14. How do you ensure compliance with HIPAA and other regulations? Compliance starts with awareness and accountability. I ensure all systems follow the minimum necessary rule for accessing patient data. Staff undergo regular HIPAA training, and we enforce strict audit trails for data access. Encryption, secure logins, and automatic log-offs protect systems. Periodic risk assessments identify vulnerabilities, and I collaborate with legal and compliance officers for updates on new regulations. Vendor contracts also include compliance clauses. My focus is on building a proactive culture where data protection becomes second nature to every employee. 15. What role does data analytics play in health informatics? Data analytics transforms healthcare data into actionable insights for clinical and administrative improvement. As a Health Informatics Manager, I oversee analytics dashboards that track metrics like readmission rates, medication errors, and patient satisfaction. Predictive analytics can identify at-risk patients early, helping reduce complications. Analytics also supports resource allocation, cost control, and population health management. By integrating AI tools and business intelligence platforms, healthcare organizations can move from reactive care to preventive, data-driven decision-making, ultimately improving outcomes and operational performance. 16. How do you handle conflicts between IT and clinical staff? Conflicts often arise from misaligned priorities. IT focuses on technical accuracy, while clinicians emphasize usability and speed. I act as a translator between the two worlds. I host joint workshops where both sides can voice their needs and frustrations openly. By grounding discussions in patient care objectives, I create common purpose. Clear timelines, compromise, and iterative feedback loops ensure both technical stability and clinical practicality. The key is empathy, active listening, and framing every decision around patient outcomes, not departmental preferences. 17. What are some common KPIs for monitoring informatics system performance? Common KPIs include system uptime, user satisfaction scores, data accuracy, and average login or load times. Clinical KPIs may track documentation turnaround, medication error rates, or time saved per patient encounter. Operational KPIs might measure cost reductions or billing efficiency. Security metrics, like number of unauthorized access attempts, are also vital. I use dashboards to visualize performance trends and identify bottlenecks. Regular KPI reviews guide continuous improvement, ensuring that informatics systems deliver measurable value across departments. 18. How do you prioritize projects when multiple requests come in simultaneously? I prioritize based on strategic alignment, regulatory urgency, and patient impact. First, I categorize requests using a scoring model, considering risk, ROI, and compliance deadlines. Projects affecting patient safety or mandated by law take precedence. I communicate transparently with stakeholders about timelines and resource limits. Using agile principles, I allocate teams for parallel progress when possible. Clear prioritization ensures high-impact projects move forward without compromising quality. Managing expectations and maintaining flexibility are crucial parts of this balancing act. 19. How do you ensure user adoption of new technology? User adoption begins with inclusion and engagement. I involve end users early in system selection and design so they feel invested. Training is customized by role, clinicians, admin staff, and IT users each get targeted support. I use pilot phases and feedback loops to fine-tune usability before full rollout. Providing on-site support post-implementation builds confidence. Recognition for super users encourages peer learning. Most importantly, I communicate benefits clearly, how the system makes their jobs easier and improves patient outcomes. 20. Can you describe a successful project you led? In one hospital project, we implemented a new EHR system across 3 departments within 6 months. Challenges included data migration, workflow redesign, and clinician resistance. I led a cross-functional team, conducted training sessions, and established weekly feedback reviews. We achieved 98% user adoption within 3 weeks of launch and reduced documentation errors by 40%. The project's success was due to meticulous planning, stakeholder engagement, and continuous monitoring. It not only modernized our systems but also improved patient satisfaction scores significantly. 21. How do you manage vendor relationships? Vendor management is about partnership and accountability. I maintain open communication and set clear expectations through service level agreements, SLAs. Regular performance reviews ensure vendors meet deadlines and quality standards. I also monitor system updates and negotiate contracts to align with budget and compliance needs. Transparency and collaboration are key, treating vendors as strategic allies rather than just service providers. I also ensure exit strategies and contingency plans are ready in case of performance issues or unforeseen disruptions. 22. What trends do you see shaping the future of health informatics? Emerging trends include AI-driven diagnostics, predictive analytics, telehealth expansion, and the use of wearable devices for continuous monitoring. Interoperability through FHIR APIs and blockchain for data security are also gaining traction. Patient-centered care and data democratization will redefine how information flows across systems. Cloud-based infrastructure is becoming the norm, enabling real-time analytics and collaboration. As a manager, staying agile and adaptable to these innovations will be key to ensuring technology continues to enhance, not complicate, healthcare delivery. 23. How do you approach training and education for your team? I design structured, role-specific training programs that blend classroom learning with hands-on experience. For major system changes, I use the train the trainer model to empower internal champions. I also incorporate micro-learning modules and refresher sessions to reinforce knowledge. Continuous education is vital, so I encourage certifications, webinars, and mentorship opportunities. Feedback loops help me tailor future sessions. The goal is not just system proficiency but confidence, ensuring every team member understands how their role contributes to better healthcare outcomes. 24. How do you use data to improve patient care? Data is the backbone of modern healthcare. By analyzing EHRs, lab results, and patient feedback, we can identify patterns that reveal care gaps or inefficiencies. For instance, predictive models can flag high-risk patients for early intervention. Dashboards track infection rates or medication adherence to inform quality improvement initiatives. Data also guides personalized treatment plans. As a health informatics manager, my role is to ensure clinicians have timely, accurate, and actionable data, turning numbers into meaningful care improvements. 25. Why should we hire you as our health informatics manager? I bring a unique balance of technical expertise, clinical understanding, and leadership experience. My proven record in implementing complex informatics systems has improved efficiency and compliance while reducing costs. I'm passionate about using technology to enhance patient outcomes and streamline healthcare operations. I'm also a strong communicator who can align diverse teams toward shared goals. Ultimately, I don't just manage systems, I drive transformation. Hiring me means investing in a leader who ensures every data point contributes to better care delivery. Thanks for watching. If you found these answers helpful, don't forget to like, share, and subscribe to Interview Q&A for more expert-crafted interview preparation videos. Remember, preparation builds confidence, and confidence wins interviews. Drop a comment below telling us which question challenged you the most, and I'll personally reply with extra tips. Until next time, keep learning, stay focused, and best of luck with your Health Informatics Manager interview.